Welcome back. You're watching McLaren Port Huron's Today's Health, and we're talking with board-certified cardiologist Dr. Elias Skaf about PAD. If you don't have any treatment, or you don't have any symptoms and things just go on, what are the complications that might arise?
The complication of PAD, Barb, happen because of the absence or diminished blood flow to the organ or the tissue. That include the pain, resting pain sometimes. The pain could happen even without any activities in the stage of PAD, and we call that critical limb ischemia. Other complications include tissue loss. We start seeing gangrene on the feet. We start seeing non-healing wound. You see a lot of patients going to the wound clinic where they have been struggling with non-healing wound on the foot for like 3, 4, or 5 months, and that's part of PAD. Other complication, which is very important, amputation as well. Once we have wound on the foot for a long time and that wound reached the bone into what we call it osteomyelitis, and that's not healed, that's going to be ended with amputation as well. Of course, lack of exercise and activity, that's another issues related to PAD, and that's either because of the pain or because of the wound and such thing. So these are the most important complications of PAD, basically. And of course, I want to add a few more things, including heart attack and stroke as well. Very important complications related to PAD.
So what are the goals of treatment then?
Goals of treatment for PAD include stop the progression of the disease from reaching the end stage, and that will include preventing the pain, which is a major factor to the patients to move around and being mobile, and also trying to provide more blood flow to the leg for the wound to heal and for the gangrene to prevent having the gangrenous formation on the feet as well.
So what are the treatment options that you have available to you to do this?
Okay. Now, we have medical treatment, Barb, and we have procedures for PAD. And when it comes to medical treatment, of course, we have, beside the points we mentioned earlier, which include controlling the diabetes, the high blood pressure, meaning medications for diabetes, high blood pressure, high cholesterol, and smoking cessation. We have some medications which basically increase the blood flow to the organ or the tissue affected by PAD. That's the only medication available. When it comes to procedures, we have what we call it percutaneous procedure. We do them through catheter from the skin, and we have also surgical procedures, and that means open surgery or bypass surgery.
How important are lifestyle changes to the treatment of PAD?
It's very important. Lifestyle changes is very, very important and crucial for the treatment of PAD.
So even if you treat PAD, are you still going to say to that patient, whether you use a percutaneous or a medication, are you still going to say, here's the lifestyle changes you need to make?
Definitely. Definitely. I would absolutely, because, I mean, even if you treat PAD, we still, and the patient does not take care of himself or herself in a way of doing lifestyle modification, the blockages will start over again. And we see that, of course, if the patient continues to smoke, the diabetes is uncontrolled, the blood pressure is uncontrolled, we're going to see the disease again and again. So lifestyle modifications are crucial for PAD.
So is it accurate to say if you have PAD in one spot on your leg, it's likely you have it in other places? Maybe just not to that extent?
Let me rephrase that in a way. If you have a PAD in certain spot, check for blockages in certain areas as well. So that's why when I see patients with PAD in my practice, I always check for CAD and vice versa. If I see patients with CAD, I'll always check for PAD and check for carotid disease, because this is the same process, which is atherosclerosis, the one we described earlier, which is the black pill inside the arteries. And that can affect any arteries in the body, the coronary arteries or outside the coronary arteries.
We talked a little bit about screening. Are there guidelines for screening?
Yes, there is guideline from screening, and that's a good question, Barb. There's guideline from American College of Cardiology to screen for PAD for any patients above age 50 with smoking or diabetes. That's how important smoking and diabetes are as a risk factors for PAD. So any patient above 50 with history of smoking or with diabetes need to be screened for PAD to make sure there is no underlying PAD.
Let's talk just a minute about medication. Is medication always a first step for treatment of PAD?
Not necessarily. Medications mainly to relieve the symptoms and increase the blood flow. Usually help the patients in controlling the pain in about 20-30% only. Really does not eliminate the pain completely.
Okay. Well, we're going to take a break and come back, and then we're going to talk about the different procedures available.
Definitely.